Zang, The Organ System of Traditional Chinese Medicine by Jeremy Voss. Page 234, Chapter 18, Case Histories. The previous chapter discussed the principles of clinical practice. Outlines of 8 case histories are given below to illustrate the application of these principles in the surgery with actual individual patients. 1. Chronic otitis media. A woman of 33 had had otitis media for 10 years, during which time the disease had waxed and waned. A recent attack had started 6 days before coming for treatment and involved pain and watery discharge in the left ear, with impaired hearing and dizziness. Her pulse was slightly wiry and slightly rapid, and her tongue was red with a moist thin coat. Diagnosis. There are 2 main types of otitis media: excess and deficient. The excess type is mainly associated with damp heat in a gan and dan, which goes upward and disturbs the ear. Signs are severe burning pain in the ear, referring to the head, and when the eardrum is perforated, there may be sticky yellow pus and perhaps fever. The pulse is rapid and wiry, and the tongue coat is yellow. This is the acute otitis of Western medicine. The deficient type is mainly associated with deficiency of Shen and Gan, with hyperactive fire ascending to disturb the ear. Discharge is thinner and more watery than with excess type. In repeated attacks, there may be dizziness, tinnitus, and impaired hearing associated with Shen deficiency. Pulse is thin and wiry, and tongue red with a thin yellowish coat. This patient showed an acute exacerbation of chronic otitis of deficient type. Treatment. The principle of treatment was to strengthen the body, especially Shen and Gan, to disperse fire and ease the ear. The points used were Jusanli, stomach 36, strengthened body and its resistance to infection and inflammation. Chiushu, gallbladder 40, and Tinghui, gallbladder 2, soothe gan and dan and regulate ear since dan channel passes through it. Even triple burner 17, local points of Sanjiao channel which passes through the ear. Strengthen effect of soothing fire of gan and dan. Taishi, kidney 3, strengthen Shen to relieve damp, and strengthen Shen Yin to eliminate heat. Strengthen Jinqi to aid ear. Since this case was of underlying deficiency, needles were used with reinforcing method, with gentle lifting and thrusting and rotation manipulation. Needles were retained for 20 minutes, and the ear points were inserted to a depth of about half an inch only. After one treatment, the watery discharge ceased, and the pain in the ear subsided. 2 more treatments were given using the same points, and then the patient was sent to the ear, nose, and throat department for examination. Only a slight congestion of the tympanic membrane was observed to remain. 2 more treatments were given to consolidate the healing, and the patient was discharged. Patient education. The patient was advised to avoid exposure to cold and not to allow water in the ear. 2. Tinnitus and balance. A man of 50, under stress for many years, lost his mother and brother in close succession. He began to feel very ill with severe dizziness and nausea, and was taken to hospital, where his speech became garbled and he became paralyzed down the left side. The speech defect and paralysis disappeared in approximately 2 weeks, leaving him with vertigo, tinnitus, and a sensation of discomfort in the neck. He had had cataract for many years, had a wiry, slippery pulse, and a tongue with a thick, greasy coat. His condition was aggravated by exposure to wind and cold. Diagnosis: stress and bereavement resulted in depression of Ganchi, hyperactive of Ganyang, and staring of Gamwind, which combined with the upward movement of phlegm led to windstroke with dizziness, temporary paralysis, and difficulty of speech and wiry pulse. The presence of phlegm resulted in catarrh, nausea, slippery pulse, and a thick greasy tongue coat. Deficiency of Shenqi was involved in the tinnitus, and deficient Sheng-yin and hence deficient Gan-yin were involved in the hyperactivity of Ganyang. External wind and cold aggravate the condition by further disturbance and obstruction of the circulation of qi and xue in the channels and collaterals of the head. Treatment: the principle of treatment was to pacify hyperactive Ganyang, resolve phlegm, strengthen Shen, and to disperse external wind and cold and clear the channels of the head and ears. Points were selected from such as the following, and used with even method. Frenchie, Yifen, and Yiming were used with moxa in addition to needle, and after this was done, the patient covered these points with a scarf until he got home, to avoid a sudden fall in temperature at this point, i.e., exposure to wind cold. Zulinchi, gallbladder 41, and Waiguan, triple burner 5, confluent points of Tai Mai and Yangwei Mai, in combination with other Dang and Sanjiao points used to clear obstruction from these Jinluo. Waiguan also clears external problems, for example, wind and cold. Fenchi, gallbladder 20, pacifies hyperactive Gangyang and internal wind. Also clears external conditions, in this case, wind and cold. Armen, triple burner 21, and Efan, triple burner 17, clear channels of the ear and dispel wind. Eman, MHN 13, specific for vertigo and tinnitus. Bai Hui, Dumai 20, calms turbulent yang in the head. Taichung, liver 3, calms hyperactive gangyang. Yongquan, kidney 1, strengthen yin and calms hyperactive yang. Taishi, kidney 3, strengthens shanqi and shenyin. Fenlong, stomach 40, and Zhu Sanli, stomach 36, strengthen Qi and Wei to transform phlegm. Patient education. There are two main aspects, reduction of phlegm and reduction of tension. The patient was advised to avoid chronic buildup of tension in various ways, and he cooperated fully in this. In order to reduce phlegm, he reduced his smoking habit, had periodic cleansing diets, and adjusted his general diet to avoid phlegm-forming foods. In addition, he was advised to avoid overwork so that Shenqi might slowly rebuild, and to avoid exposure of his head and neck to wind and cold. The tinnitus was almost completely removed after 4 treatments, and subsequently both tinnitus and vertigo have been maintained at minimal levels by regular treatment, once every 1 or 2 months. 3. Angina Pectoris. For 6 years, a man of 50 had chest pain and breathlessness only on exertion. For a period of 4 days, 1 year ago, he had continual chest pain, which was then diagnosed as a mild heart attack. Members of his family also had heart conditions, and he had suffered from nervousness and insomnia since he was a boy. He had been involved in several serious car accidents and for many years had severe stress in his business and was a great warrior. The bouts of chest pain were initiated or aggravated by exertion, cold, or stress. He had palpitations, felt the cold, had difficulty in urinating, had a wiry, slightly slow pulse, and a pale, flabby tongue. Diagnosis: the chest pain, palpitations, nervousness, and insomnia indicated a Shin disorder. Since pain was a dominant factor, stagnation of Shin was a main disharmony, although cyanosis was only slight in this case, and the tongue was pale rather than purple. The pale tongue indicated deficient yang, deficient qi, and deficient shui. The sensitivity to cold, aggravation of chest pain by cold, slightly slow pulse, and flabby tongue indicated deficient yang. Deficiency of qi and yang of Shen led to the inability of Shen to hold down qi sent by Fei, leading to breathlessness on exertion. It also led to impairment of Jin metabolism, involving difficult urination. In addition to the inherent tendency to Shin weakness, various emotional stresses contributed to this condition. Firstly, the Shen-Shin relationship had been weakened by the severe fear, flight, and shock involved in the series of car accidents. This resulted in deficient qi and yang of Shen and Shin. Secondly, the Pi-Shin relationship may have been weakened by the continuous chronic worry, resulting in. Thirdly, the relationship between Gan and Shin may have been impaired by the chronic depression, frustration, irritation, and anger involved in his business stresses. This resulted in depression of Ganchi and depression of Zhongqi, both leading to stagnation of qi and shui in the chest region especially, and in particular to stagnant xinshui. In summary, the pattern of stagnant xinshui is accompanied here by deficient xinyang, deficient xinqi, and deficient xinshui, by deficiency of both shin and pi, and by depression of ganqi. Treatment: between attacks, combinations of points were selected from such as the following, and used with even method. Gongsun, spleen 4 and Neiguan, pericardium 6. Confluent points of Chongmai and Yingwei used to strengthen Shen with Moxa on Gongsan. Juque, Wenmai 14, to strengthen Xin and Wei. Shanchong, Wenmai 17, to strengthen circulation of Chongqi, to dispel stagnation, to regulate and to suppress laborious qi, and expand the chest. Both Juque and Shanchong used with Moxa. Shanshu, bladder 23, to strengthen qi and yang of Shen. Pishu, bladder 20, to strengthen function of pi to form qi and shui. Geshu, bladder 17, to strengthen circulation of qi and shui and to relieve stagnation. Xinshu, bladder 15, to strengthen qi and yang of Xin. Taichung, liver 3, to relieve depression of ganqi and stagnation of qi and shui. Patient education. Great caution was advised with respect to physical exertion and exposure to cold. The most difficult aspect was the combination of the deeply ingrained pattern of emotional disharmony with the excessive overwork. The patient was a perfectionist and was advised to moderate this tendency, since it led to both permanent dissatisfaction with himself and others, and to an increased workload. He was advised to avoid emotional confrontations and conflicts of all natures wherever possible, since these would provide acute aggravation of stagnation of Xinshui and possibly lead to another spells of continuous pain or even to a full-scale heart attack. Various moderate activities of a relaxing, creative, and social nature were suggested, to provide a break from the continual pattern of frustration and worry. 4. Chest pain. A man of 50 had chest pains at the age of 30 and on about 10 subsequent occasions. The last occurrence was in the January of the year he came for treatment, following working in the snow. On one occasion, the pain was severe, but was generally dull and of variable position, and anywhere in the chest region, apparently in the muscles. It occurred any time, not necessarily immediately after physical work, and indeed occasionally when the patient was sitting down and relaxed, and not when he was active. There was catarrh and shortness of breath, and the last two fingers of both hands had numbness and tingling. 18 months ago, he had had a sudden severe pain from the top of the spine to the head. From January onwards, he had considerable anxiety, and there was much belching, but no other signs of digestive disharmony. The patient was overweight, somewhat sluggish, with cold feet, slippery but weak pulse, and pale, flabby tongue with greasy coat. Diagnosis. First of all, there are signs of deficient qi and deficient yang: sluggishness, overweight, cold feet, weak pulse, and pale, flabby tongue. The catarrh, slippery yet empty pulse, and pale, greasy tongue suggest deficient qi and yang of B, resulting in formation of phlegm. Secondly, there are signs that at first sight might suggest Shin disharmony, specifically deficient in Shin Yang and stagnant Shin Xue. The chest pains, shortness of breath, and numbness and tingling going down into the last two fingers. Also, the chest pains were aggravated by cold and exertion, for example, working in the snow. However, this patient did not have a Shin disharmony. He did not have palpitations, the characteristic signs of Shin disharmony, nor the irregular pulse quality with which they are often associated. The shortness of breath was due to smoking cigarettes, not to Shin weakness, and the finger numbness derived from the trauma of the neck vertebra. If it were stagnant Shinshue, the pain would be severe and stabbing, rather than dull, and the fixed rather than variable location. If deficient Yin were involved, the pain would be worse after exercise and improved on resting. In this case, on some occasions, the reverse was true. From January, there had been considerable stress, and this was when both chest pain and belching began. In TCM, belching is usually due to invasion of P by Ganchi, following emotional stress or depression. This patient had a history of periodic ache in the chest and rib muscles. This may be due to partly to inherent weakness in this area and partly due to a sudden, unaccustomed use of the chest muscles, combined with invasion by external cold, as when working in the snow. Also, the general deficiency of qi and yang tend to general poor circulation of qi and shui. This was aggravated by depression of ganqi due to stress, resulting in obstruction and irregular flow of qi, and also phlegm rising up to the chest and obstructing the channels and collaterals of the rib cage. There is not a major invasion of cold, or the patient would have complained of coldness in the chest. Nor was there a major depression of ganchi, or there would have been other gan signs. Similarly, there was not a severe obstruction by phlegm, or the patient would have complained of stiffness and heaviness in the chest, rather than ache. Nor had the sudden use of the chest resulted in much injury to the chest muscles, since rather than aggravating the pain, further exercise tended to relieve it, suggesting stagnation of qi, relieved by movement. None of these factors was severe, but all combined together to produce the chest pain. The fact that pain was of a variable rather the fact that pain was of variable rather than of fixed location and was dull rather than severe suggested stagnation of qi rather than stagnation of shui. In summary, the local deficiency and stagnation of qi in the muscles of the rib cage with the dull pain of variable location was associated with the combination of the following factors: general deficient qi and deficient yang, phlegm resulting from deficient pi qi and deficient pi yang, stagnation of qi from sudden overexertion of chest muscles, pattern of previous weakness, depression of ganqi, temporary invasion by external cold. Treatment. The following points were used with reinforcing method and moxa. Guanyang, Renmai 4, strengthen qi and yang. Qi high, Renmai 6, strengthen circulation of qi. Zhongwang, Renmai 12, strengthen pi and wei to eliminate damp and phlegm. Shanzhong, Renmai 17, dispels phlegm and fullness from the chest by invigorating circulation of qi. Neiguan, Pericardium 6, regulates digestive system, opens the chest, and calms the mind. Taichung, River 3, regulates gan to reduce invasion of qi by gan and removes stagnation of qi in the muscles of the chest region, calms the mind. The chest pains had gone completely after 4 treatments, so treatment then concentrated on the numbness in the fingers, with occasional pain at the back of the neck. Hoshi, small intestine 3, and Shenmai, bladder 62, the confluent points of the Du and Yang channels, used to remove obstruction from Du-mai and to relax tendons and muscles. Also, Hoshi is a local point for finger problems. Da Chui, Du-mai 14, clears obstruction from Du channels, especially in the neck region. These points were used with reinforcing method of moxa, and the finger problem was much better after 2 treatments. Patient education. The patient was advised to stop smoking, lose weight, and take regular gentle exercise, all of which he did with good results. However, he became over-enthusiastic about the weight loss, became too thin, and started to lose strength. This mistake was corrected, and this patient remained well with treatment every 3 or 4 months.